This is Sarnia Lambton Daily for Wednesday, April 1st. Good evening, I'm Terry Doyle. A retirement community in Sarnia remains the focal point of the COVID-19 outbreak in the region. As of today, 11 people affiliated with Landmark Village have tested positive for the virus. This includes 4 residents who have passed away. The majority of positive cases have come from the residents, while staff members are also impacted. Measures have been taken to try and reduce the spread, such as eliminating use of communal areas and having meals delivered directly to the apartments. In total, 56 people have tested positive for COVID-19 in Sarnia Lambton, up 17 from Tuesday's number. The overall number of deaths is now at 6 in the region as well. Medical Officer of Health Dr. Sadit Ranaday says the health unit continues to trace contact among positive cases, but it will soon get to the point that community spread will be the likely cause.
It becomes harder to trace back people's connections, and so at a certain point we may just have to leave some of them and not be able to connect them to other people and satisfy ourselves that this is in fact community transmission. We're not quite there yet. We're still giving it sort of one last good go to see if we can connect several of the other individuals back into the groups that we've identified. Having said that, though, again, I'll reiterate that none of our ability to document community transmission should keep people away from acting as if there is community transmission, right? So we're still encouraging intensive physical distancing. You'll note that there have been additional measures added by the province to close outdoor recreational spaces. We're still asking people to keep distance where they can and also to discuss things with their employers, such as remote work where possible. And keeping your other social interactions to a minimum, to only those things that are absolutely essential.
The City of Sarnia and Sarnia Police are working together to help people get information and also report violations of physical distancing rules. 1-877-4-SARNIA is a toll-free number for any COVID-19 related inquiries. This includes questions regarding services that may or may not be still available, but also to report issues where physical distancing rules are not being adhered to. Emails can be sent to covid@sarnia.ca. There have been reports of residents calling 911 looking for information. Absolutely do not do that. 911 is only for emergencies. Let's go to Sarnia City Hall now. Mayor Mike Bradley joins me now. And Mike, we just talked about it there, the new line, whether it's by phone or by email, for people to let authorities know if there's situations where physical distancing is not being followed. I'm sure in your shoes, unfortunate it came to this, but at the same time necessary at this point.
Well, Terry, that's a good observation. Personally, I had some difficulty with it, but I accepted what was going on, that it had to be done. And here and in London, it was very, very simple. The 911 lines were being clogged by people calling in asking questions. 911 is very simple. It is set up for emergencies, for police and fire and EMS. And it is not to be used as an information service. And that's why this line's being set up. I heard someone, when I was doing another media thing today, say, well, is it a snitch line? No, it's a line for people can call in for information. And if they have a concern about the actions of others, and this is not unusual. For many years, for decades, we've had Crime Stoppers where people can report and give information and then it's checked out. And given the fact that there are people that continue to ignore some basic common sense as it relates to physical distancing and their own actions, it is necessary.
Was it a little disheartening on the weekend when we saw the warmer temperatures and we saw the reports, we saw pictures come in through social media of some of the park gatherings and things like that, where it's like, well, hold on, just because it's nice out, no, there's still rules we have to follow right now.
Well, Terry, it was, and welcomed Premier Ford's new regulations that gave us the ability to act. And I think I need to make this point over and over again, that when I get asked, for example, why aren't you locking down the city? We don't have the authority to do that. And if you're going to have a lockdown, which I support for the next week or two, you need it to be consistent across the province, across the country. But the legislation that just came forward, the regulations, gave us the ability to go in, which is what our staff did. They did an excellent job going in and covering up the parking lots, stopping people going there. It means they can still walk to the park, but in Mike Weir Park and in Canterra Park, they won't be parking there. And the reason why that step was taken was people were getting out of their vehicles and interacting this last weekend. And with warmer weather on its way, it was just going to get worse for us. So this was a good action. I applaud the Ford government for taking the step. It gave us the ability to act.
And I saw city staff right away. Yesterday morning, I saw caution tape around areas as well. And I guess that's where it shows where even city staff have had to be agile in this case, adjusting. It's one thing at the political level, but I'm sure you must be pretty happy with the way the staff have been able to adjust through this as well.
Well, Rob Harwood and his group did an excellent job, because by the end of yesterday, we had those places blocked off. And we are working also closely with Point Edward, so we're sort of linked together on what we're doing. But I think the key, I just had a question about why are you keeping city staff on the council and the CAO? The answer is because they're needed. If you look at our works people, and obviously police and fire, it's self-evident, but the Parks and Rec people were out there yesterday closing off the parks, covering up the playgrounds, doing the things that we need to do to protect the public from themselves in some cases. And at the same time, and I've been pushing hard on this, I haven't totally won the battle, is that we will be doing ticketing. And the police and the bylaw enforcement people will be out there, because I believe people have had enough time to be self-educated about this. And we need to take some strong action. Toronto's doing the same thing, and other places saying, okay, education was fine up to a certain point, but now we need to do something to protect people. The medical officer of health has said repeatedly, these next 2 weeks are critical, that we need so much to diminish human contact and to take the steps that we can locally, and I hope eventually provincially, that will make the difference on that human contact so that we can get this hideous virus under control.
And when you talk about ticketing, we're not talking a little slap on the wrist. I've seen it could be fines up to $1,000. If people aren't getting the message before that, I think I got a big slap on the wallet. And hopefully it doesn't get to that point, but I guess that just shows people how serious this is right now.
That's true. Now, the police chief said yesterday, and the CAO of the city, that they'll use some common sense and deal with people. But there are people who simply are defiant, and if that's the case, here's your fine. It's no different than using the cell phone in the car or doing other things that you don't want to enforce those things, but you have to for public safety.
As we continue along, one thing you talked about, and you just touched on a minute ago, but you've spoken about it over the last few days, is that if they gave you the keys to the province, maybe it is time to shut things down for a week or 2 weeks. And I'm sure people are saying, that sounds scary, but I guess we're maybe at that point where it's necessary.
Well, if you go online and look at London Free Press today, Jane Sims did an interview with me yesterday and a column. And I've been calling for weeks to take that. Again, I don't like it as a civil libertarian, but to say to the country, province, for this next week or two, we're going into total isolation. If you look around the world and you follow what's happened elsewhere where they've managed to get a handle on this virus, that's what's happened. Yes, it'll be painful. Yes, it'll be difficult to enforce, but I don't think there's any question at this point. It's necessary.
As you get feedback from people, emails, calls come in, what are you hearing just at the grassroots in terms of communication, people getting that information? People, it feels like if you don't know yet that you need to physical distance, for example, you haven't been listening, haven't been looking, but just in general, what are you hearing from people at the grassroots level in terms of what's been going on locally?
Well, it's interesting, Terry, when I get one that's critical about why aren't you doing this and doing that, and I had one yesterday. Well, why didn't you declare an emergency? Well, we did. We did on March the 18th. And then you ask the question, well, where do you get your media? And you find out they're either ignoring the media because they don't want the negativity out there, but if you're not taking that responsibility on to understand what's going on in your own community, it makes it very challenging for us to do that. Now, one of the things I've been asking our staff to look at, and we're working on it for next week, is to have the key people in the primary control group, the CAO, the fire chief, police chief, medical officer of health. We would make ourselves available for the public to ask questions, and the media once a week, perhaps maybe twice a week, in a forum where they can call in or email and contact us, and we can deal with their questions. And I think that would be a good step forward for the community, and I'm hoping that your TV will be part of that.
Absolutely. We're here to help out any way we can to get the word out and certainly share the message around. Let's shift gears to the positive side, and we've seen the community coming together to help each other out. We saw yesterday, it was the first responders saluting the folks at Blue Water Health, and as much as we're dealing with difficult times and there's still a lot more that needs to be done, it must be rewarding at times when you hear those stories of people helping people.
Well, it is, Jerry, and I think you need almost one of those a day per for each community. On Saturday, I went with a lot of other people driving by Eleanor Vargo, who turned 90, her house to celebrate her birthday, and it was just uplifting. The same yesterday at Blue Water Health, to see all those police, fire, and EMS go by, and it was spontaneous. Mike Otis and John from the police service came up with the idea from looking at other cities earlier in the day, And it happened very, very quickly. And to see people out there who work at Blue Water Health, social distancing, out there, very emotional about what was happening, it was rewarding. And as I said earlier, you almost need one of these events a day because of the darkness that we're all going through, and the pain we're going through, and the anxiety and the mental health issues there. I try now only once a night to get the news that I need, because I'm getting it anyhow from other sources, but just to focus on and try to find other ways to keep my mind clean and upbeat. And those type of events make a huge difference.
We'll tease it a little bit. Coming up on our next segment, we're talking to some people down in Huron who have been doing grocery deliveries for senior citizens, and certainly that's a big help as well. So we'll have that on the other side of the break. And I guess that sort of tees into what I was going to ask you. We do have an older demographic at times, and I guess this is where even more important to keep an eye on your neighbors. And if somebody needs groceries dropped off or someone needs something picked up, it's much better if we can keep as many people as possible in their homes.
Oh, it's true. One neighbor is 92 years of age. She has family that are helping her, but I left her a note saying, is there anything I can do? Just let me know and I can go take care of that for you. And I think if we can all do those type of individual things, it makes a huge difference. And and one of the problems having an isolated older population is that not everyone has a support person or a group or a family person they can turn to. So we need to try to do that, and what the Corona group is doing is excellent. There are other groups throughout the city trying to help people that need help, and people shouldn't be, especially now with this new hotline, if you have a need, let us know and we'll see if we can solve it for you.
Well, Mayor Mike Bradley, appreciate you joining us. We will be checking in with you, Mike, on a regular basis as we all work together to get through this. Thanks for joining us.
Thank you so much, Terry.
There's Sarnia Mayor Mike Bradley. Stay tuned. More to come after the break on Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily here on your TV. Throughout the pandemic, we've seen people coming together, helping each other out, helping their friends, helping their neighbors, helping their community. Let's go to Huron now, where Tracy Kingston joins us now from the Optimist Club. And Tracy, I've heard stories already coming from your area of people, yourself and the club, helping each other out, especially when it comes to groceries. Fill us in. What's happening out there?
Well, the mayor asked me last week, Mayor Arnold of St. Clair Township did contact me. There was a group down in Port Lambton and Sombra helping their community. And he thought, well, we might as well expand it for the rest of the township. So since I'm a councillor up this way and an Optimist member, he thought I could help out. So basically what we do is people call into Blue Water Foodland, they take their orders, we come, we pick it up, and then deliver it straight to their homes and do a doorstep drop off for them.
That's great to hear, and I'm sure, how is it? I've got to think things have gotten busy.
Oh, we started officially last Tuesday. I know Foodland did a few on their own, so we've done about 180 deliveries already. We've also raised $1,000 for our local food bank. People are so generous and kind. They just appreciate it so much. So basically, we've kept probably about 250 people out of the grocery store. So that's very helpful as well.
No, that's great to hear, that people certainly coming together. And I've got to think that's the big key right now, helping out especially those senior members of the community who it's probably best for them not to be around the grocery stores right now.
Oh, definitely. Yep. It's like everyone's saying, it's best to stay home, and we're really glad we can help.
How many people roughly have been helping out with these grocery deliveries right now?
We've got about 6 to 8 people. We're kind of keeping it a little tight because I don't want, to expose other people or a lot more people out there as well. So there's about 2 of us now doing it each day. We pretty much go from noon till 5, pretty much solid.
Well, I appreciate you giving us a few minutes of your time. Now, you're a small business owner there with the flower shop in Corona. How are things as a small business owner right now during the pandemic?
Right now, it's pretty tough. I've had to lay my staff off. I'm lucky I've only got a couple of staff, which is helpful. But the biggest thing is the supply chain has basically been cut off. Now, I do have some fresh flowers coming in today, but that's the biggest thing, is there's no supply. And because people can't get into your store, it's a little tougher. But we're used to selling on the phone and on our website as well. So we're still here doing deliveries, and I will put things out for pickup outside the store as well.
So I guess, and that's the thing now, I understand being able to be a little resourceful, where the vehicle you use for the flowers, of course, is now being used for groceries.
Yep, people will see the K's Petals and Plants van pull up, and they're I think a little disappointed there's no flowers coming, but they're more than happy to get their groceries for sure. And I have a driver that works for me, and she's volunteering as well, so that's been very helpful.
Well, sounds like a one-stop shop situation we get. You get your groceries and your flowers heading towards Easter all at once. I see a marketing opportunity here.
Oh, my brain's been going, but I got to come up with something. I got a week till Easter, but we'll come up with something.
We talk about, of course, the work shifting back the group coming together with the Optimist Club and with the groceries. Mm-hmm. I've got to think this is sort of a sign where I'm sure this isn't the first time where people, and especially in your area, have come together to help each other out. But it must be rewarding when you get that feedback of how appreciative people are.
Oh, it is. I think one of the drivers yesterday, she encountered somebody that was pretty much in tears, saying how much she appreciated us coming. And people are like, we don't know what we would do without something like this. So people love it for sure.
And I understand, I was talking to someone down your way actually last week, and yes, is it a case too where sometimes even just neighbors are checking in on neighbors and people, checking in on those senior citizens just to see how are they doing? Do they need anything? And I've got to think that just shows that community spirit.
Oh, definitely, because I know I've phoned a lot of my own neighbors that really are not in touch with them very often, but they do enjoy even just the phone call for the personal contact as well.
Tracy, you've had a chance, and of course with your counselor hat on as well. What message would you have for some of your, your neighbors there, just in terms of keeping everyone safe and of course looking out for each other as well?
I think it's basically just what everybody's been saying. Like you said, look out for everyone, stay safe, and just don't take any risks. I know my kids are a little upset with me being out in public, but I said, you know what? One person being out is better than having, 50 people out in a day. So hopefully we can make a difference.
And as you said, keep, triple digits when it comes to the number of people you've kept out of the grocery stores as well.
Yeah.
Tracy, on behalf of us here, certainly please pass along the kudos to your whole team that's working together to help people out at the Optimist Club, and we'll keep in touch and stay safe.
Excellent. Thanks a lot, Terry. Appreciate it.
That was Tracy Kingston of the More Optimist Club in Corunna, and also a small business owner and a town councillor there, and certainly very involved in helping out people throughout the area. Some other good news coming in. The St. Clair District School Board has made a $5,000 donation towards the United Way of Sarnia Lambton Compassion Fund. Meantime, 2 organizations have been announced as recipients from the new fund. Rebound will receive $5,000 towards the Hub program, as well as moving to some online platforms to help out their clients. And the Women's Interval Home also receives $5,000 from the United Way of Sarnia Lambton Compassion Fund. This is helping for social and physical distancing for their clients as the Interval Home continues to serve its clients throughout Sarnia Lambton. Also, a big shout out to Kelgore with a $25,000 donation to Blue Water Health's special COVID-19 fund, as once again we're seeing people helping out each other in the community during this difficult time. Stay tuned, more to come on Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily here on your TV. Many people working from home right now as we deal with the pandemic, but in some situations we talk about not only essential services, but there is no option to work from home because of where the workplace is. Let's bring in Don Adam, Executive Director of Huron House Boys Home. And of course, the Boys Home is the workplace. And Don joins us now. And Don, take us through what your staff and yourself and the residents, the kids are dealing with right now, because not an easy time, I'm sure, for everyone, but I'm sure the staff are making the best of it.
The staff actually are being heroes. They're continuing to come to work. We continue to service the boys that we are servicing. With restricted home visits and certainly access to the building, constant cleaning of the building, and trying to maintain some form of academic programming. We're communicating with the Board of Ed and getting schoolwork and Google Classroom, and of course doing our therapeutic programming. The kids have also been really good. They understand the situation. They're bummed by it, and we're trying to maintain contact with families through a variety of means, virtual and phone and etc. But it's unusual situation, certainly.
You talked about home visits and having to put restrictions on that, obviously to keep the boys safe, and risks of exposure being outside the home. Can't be easy though. So what sort of things are in place, even using, I'm sure, some technology to help out fill that void? It doesn't completely fill it, but at least help out a little bit.
it doesn't fill the void. The boys have always had frequent and constant contact with families, through our own phone or their phone or devices. That really hasn't changed that much. We have been using FaceTime and Zoom and those kinds of technologies to maintain contact with the families, but we can't do our family counseling virtually. Our in-house social worker is continuing to come to work, so the boys are getting their counseling, but our psychologist, who comes from London, is not coming. He only comes one day a week, but he's not right now. So there's certainly some staff. We've restricted some staff. They're working from home as much as possible. Our admin and business office, just to try and keep them safe. And it depends on their living situation, who they're living with, who they're taking care of, and their age and their health situation. So there's a variety of aspects. We are concerned what the future holds. There's an additional cost to us, of course, because no school right now, and I really don't anticipate they're going back on the 6th, or the emergency situation has been extended to the 13th. But I really, we consequently have to have more day staff because the kids are home. So there's additional costs and burdens to us. But honestly, the community continues to be very supportive of us, dropping off food donations at the door, not coming in, and continuing to support the Boys Home, which is so appreciated.
I know you had the Men Who Cook fundraiser at the beginning of March that thankfully was able to go off because before this all went in place. We've seen with a lot of organizations, fundraising can be more difficult right now. What's your message to the community as we move forward? I know the next scheduled event, big event, will of course be the Father's Day Run Walk going on at Mike Weir Park. But as you move forward, what's sort of the message for the community in terms of how they can assist Huron House Boys Home?
Well, we certainly appreciate the ongoing community support. We're in our 50th year, which is a remarkable milestone to achieve. Our run walk is slated for Father's Day, and we are already planning that it may be a virtual race. There are some technologies that can be used through Race Roster, which our registration is, and we have already had give or take 60 or more participants register for that race. Of course, there's no bridge race this year, unfortunately. It may have been a good year for them to not have it, just given the situation, but we're not quite sure how we're going to pursue the Run Walk Skate Bike. It will not be in person at this stage. We're trying to find alternatives, but any support that can be given. We are desperately looking for a riding lawnmower, about a 4-foot with a 4-foot cut, to replace our 1987 and 1989 lawnmowers. So we're looking for those kinds of things, and we continue to take closed food donations, nothing open, and we're wiping everything down before it's coming into the building. So and of course, monetary contributions are always appreciated.
For more information, you can check out their website, hhbh.ca. Don, I will guarantee you, if it's a virtual run this year, I'm in. Regular run, probably wouldn't see me out there. The virtual run, I'm definitely in for this year.
Well, I'm thinking that you still have to run, Terry.
Oh, well, hold on. The virtual run, that's where it was right up my alley.
Sorry about that, but I think you time yourself, and there is, and then we would. Our thinking right now is ship off T-shirts and prizes and things like that. But my understanding is there's a level of trust, and you still have to run.
Oh, we'll have to work on that. Maybe I'm back to the walk then. Don, we appreciate you joining us. For everyone, stay safe and keep in touch.
Okay, thank you so much.
That was Don Adam, Executive Director of Huron House Boys Home. That's going to do it for tonight's edition of Sarnia Lambton Daily. For all of us here at Your TV, I'm Terry Doyle. We'll see you tomorrow.